Hi, I'm Dr. Matthew Fletcher from Texas Oncology, Medical City, Dallas. I am being compensated to speak by Y-mAbs Therapeutics, the sponsor of this program. How do you explain high-risk neuroblastoma to a caregiver or family? Neuroblastoma is the most common pediatric extracranial solid tumor, and nearly half of the patients that are diagnosed with neuroblastoma are classified as high risk. When I talk to a caregiver or family member about high-risk neuroblastoma, I discuss how the neuroblastoma risk groups are determined based on characteristics of the patient, such as age and characteristics of the tumor itself, in addition to how the disease is spread. I then discuss with the family or caregiver the tailored therapy that is recommended for that individual patient's risk group. We know certain patients have a much higher risk of the tumor coming back, or that it will spread more aggressively. Therefore, we must treat those kids with more aggressive treatment. The very aggressive disease in those kids is called high-risk neuroblastoma. How often do you see neuroblastoma with bone or bone marrow involvement at diagnosis? Statistics show that 2 out of 3 patients with high-risk neuroblastoma have metastatic disease in the bone or bone marrow. Bone marrow is the most common site of metastasis, followed by bone and liver, and so those are areas where we will frequently see involvement. In my clinical practice, I see bone involvement in about 20% of patients. However, in high-risk disease, it is more common. Bone marrow involvement can be seen in non-high-risk patients as well, notably in infants. How do you discuss the impact of bone or bone marrow involvement with a caregiver? Having disease in the bone or bone marrow does impact the way we treat neuroblastoma. In some cases, disease in the bone or bone marrow can be the determining factor that classifies a child as high risk, which would lead to more intensive therapy. Nearly half of patients with high-risk neuroblastoma are refractory or relapse after frontline treatment, which means 1 in 5 patients are refractory, meaning having an inadequate response to induction therapy, and 2 in 5 patients will relapse, or the disease will come back, after frontline treatment. There are treatment modalities that have shown to be effective for bone or bone marrow disease that should be considered with your doctor. Immunotherapy may have a role depending on where the involvement is and the child's response to therapy. Bone or bone marrow involvement may dramatically change how we attack the disease.